Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hi, everyone, and thank you for joining our webinar today on the 2021 Billing Regulatory and Workflow Updates. My name is Brandi Fulmer, and I am a Home Health Product Manager with Axxess. I have been in the home health space for a combined of about 7 years now, and I'm very excited to be walking you through our webinar today.
And hi there, my name is Sophia Saldivar, and I am a home health product analyst, and I have been in the home health industry for about 10 years as well. We'll be going through some of these changes for you as 2021 approaches.
So our agenda for today, we are going to take a look at the 2021 Medicare regulatory changes. We're going to take a look at the previous solution highlights within Axxess, as well as the 2020 solution innovations that we've got for you this year. And then we're going to switch gears a little bit and talk about our educational resources as well, so that you know where to find all the information that we're going to go over today and much more. So starting with the 2021 Medicare regulatory changes, we first want to talk about the upcoming 2021 changes. The biggest change that we're seeing is that beginning January 1st, wraps will no longer be reimbursed. As you know, many agencies have come to depend on that initial reimbursement, which has historically been anywhere from 50 to 60%. And with PDGM in 2020, that was decreased to 20%. So going into 2021, that will be a 0% reimbursement for each wrap submission, with full reimbursement being granted with the final claim submission. With that change comes some updates to the requirements around wrap submission as well. So as part of those requirements, a verbal order will be required, and the first billable visit has to be done prior to the wrap submission. There has been some additional information coming down from CMS within the last few weeks clarifying that requirement for the first billable visit, in that it needs to be done, but the documentation doesn't necessarily have to be completed within the software system itself. So within Axxess, as you know, clinicians have the ability to start their documentation. They can save that documentation for a later time, but once they've actually completed the visit itself within the home, that is what is going to fulfill that requirement for you. Both wraps for the 60-day period can now also be billed at the beginning of each 60-day episode rather than at the beginning of each 30-day billing period. So that's going to save some time there for our organizations. And another change coming is that reimbursement penalties will be issued when the submission is not considered timely. So timely submission is considered to be within the first 5 days of that episode. So the wrap does need to be submitted within that 5-day time frame. Should it not be submitted within those first 5 days, a penalty or reduction of 1/30, which breaks down to about 3% each day, the wrap submission is considered late. So all of these changes are really setting us up for the phase out process of the wraps altogether, as CMS is going to move to introducing the notice of admission, which is also going to be referred to as the NOA. So talking about our previous solution highlights within the Axxess Home Health product itself, we've got a couple of things that we wanted to share today. So we've got our no pay wrap feature, our PDGM dashboard, our PDGM modeling tool, and our enhanced financial reporting suite. Each of these things we are going to demo for you here in just a few minutes. But really what this was Axxess's way of preparing the product and our organizations for these changes that we knew were coming down the line. So we wanted you all to feel comfortable and confident within Axxess Home Health that we really had your back and that we were looking forward to make sure that you all could be successful and really thrive under these upcoming regulations.
And so as we know, part of these upcoming regulations, and Brandi touched on them a little bit, are some of those loosened wrap submission requirements. And so we no longer need that first billable visit for all of our certification periods. We really do only need that for that start of care. And so that's going to be one of those first loosened requirements. Secondly, as Brandi said, with the second 30-day wrap, as we can submit both both of those wraps at the start of the episode, the second 30-day wrap can actually use the from date of that second 30-day period to be able to bill out the wrap on time. And so that is something that within our solution, we will auto-populate for you. And so you will not need to worry about inputting a date in there for you. It will automatically show the second 30-day, and we'll go through what this looks like momentarily as well. And as you know, once these validations are met of ensuring that that first billable visit validation is complete and that we've got the second 30-day wrap available to bill, those both wraps can be submitted at any time, truly beginning January 4th, although this change starts on January 1st. CMS is implementing this change on the 4th. And so that gives CMS an opportunity to ensure that the direct data entry system, or DDE, is accommodating for these new changes.
So looking at our 2020 solution innovations, we really want to touch on some of the things that we've been doing this year to make sure that everybody is prepared. The first thing we have is our Axxess analysis. This was released in July of 2020. That is a feature built into our quality assurance, or our QA feature within Axxess Home Health, that is really going to showcase how a patient is progressing. Are they, for some of those important Axxess items, are they improving? Are they declining? Are they stabilizing? Because we know all of that is going to affect your reimbursement for that patient. Additionally, we implemented the wrap aging tool in October of 2020. That is a tool that we implemented directly within our billing center. Now there is a column within that billing center that is actually going to notate how many days since that wrap, how many days that wrap has been sitting out there. So is it 1 day old? Is it 5 day old? It's going to go all the way up to 99 days for you. And if it's past that, it'll be at 99 plus. But we wanted to make sure that from a billing perspective that you had that information so that you knew what wraps are really sitting out there that you really need to be showing some love to and get those out the door as quickly as possible.
And part of that conversation then starts the conversation of our no pay wrap automation. And this is really geared to our billing clients specifically to ensure that we're getting those wraps prepped as quickly as possible so that they are able to be submitted and accepted quickly as well. And so this no pay wrap automation, we did release this at the end of November of 2020. And again, this is just to maximize efficiency for our billing clients. Then we'll go to, and one of the other releases that we've done recently is our revenue posting. And so we have updated our split percentage payment so that it can be appropriately matching the 0 to 100% split that we will be seeing for 2021 in the submission of the wrap and the final claim. Our billing center updates were also updated in December along with the revenue posting. And these billing center updates really are towards the billing indicators, the wrap aging tool that Brandi just spoke on, as well as incorporated in this portion. And what we're doing here is ensuring that we can bill both wraps out at the same time. And we also want to make sure that we have new indicators within our billing center identifying that we no longer need the Axxess assessment, so that green check mark is no longer a requirement. Neither is a green check mark for that first billable visit for those subsequent billing periods. So you'll see that new feature as we demonstrate this product for you in just a little bit for those new indicators. And then lastly, we have started and have put into play the HMO payer setup. So for our managed care payers, specifically those that are episodic, we wanted to make sure that we were able to customize each payer based on their adoption of these new 2021 changes. We knew with PDGM, we saw that a lot of these HMOs maybe didn't start January 2021 or 2020 rather with the PDGM changes, and maybe started to adopt them closer to February or March and so on and so forth. So we wanted to make sure that we had some customization options for each of our clients to ensure that all of our payers are getting the attention that they deserve and that we are setting them up appropriately to bill, again, more efficiently. And so all of these solution updates or software updates are available within our Help Center, and that's the graphic that you'll see there on your screen. The most recent, as you'll see, is that no pay wrap setting for episodic payers. So we always want to make sure that this is a resource that is something our clients use readily or frequently, rather. And again, we'll show you this again as part of our educational resources towards the end of our webinar. Next, we're going to go ahead and go into a product demonstration. So the moment we've all been waiting for.
Okay, so the first feature that we are going to talk about for this demonstration is going to be that no pay wrap feature. So to navigate to that no pay wrap feature, that is a payer setting. So we're going to go to the View tab, Lists, and then Insurance Payers. Now here we are going to edit one of our Medicare payers. And here you can see, so part of the original phase out process was to have the new home health organization start out by utilizing this rule of the no pay wrap. So Axxess wanted to ensure that we had a way in the system for new agencies to set this up within the Axxess product so that they would be in compliance with this particular rule. So what we did was add this no pay wrap setting or toggle within the Medicare insurance payer setup itself. This option that you're seeing here on the screen with the yes and no toggle is what you would see when going through the setup. So Medicare is a default payer within Axxess, and we know that having this option was vital to ensuring that when we were creating our financial reports and reviewing cost analysis for each episode, that we were allotting for that 0% reimbursement for those agencies. So even though this was created to keep those agencies in compliance, it really has been extremely beneficial for Axxess to be able to mimic what that process is going to look like within the system itself, really preparing for those 2021 regulation changes. The next thing we are going to take a look at is the PDGM dashboard. So the PDGM dashboard, that lives within the patient chart itself. So we see here within that patient chart, we have right next to the new tab, we have a PDGM dashboard tab. So within the PDGM dashboard, as we were thinking about these new CMS rules and really looking ahead to 2021, we wanted to create a tool that would really help agencies adopt these new regulations around PDGM and the upcoming billing changes in a really easy and efficient manner so that you can really be successful and continue to grow under these new rules. So this dashboard, as I said, available within the patient chart, you can see here there is a ton of information that each agency will need to be aware of as they are looking at what that potential reimbursement is going to be for the patient. There's some key points we want to call out here. So one of those is going to be the outcome potential, which allows for us to be tracking potential changes and improvements to outcomes to really ensure that the star rating for the agency is looking good for all of your clients. Taking into account all of this information, you're also going to need to be able to get the full picture of this patient and make educated decisions that are going to positively affect the patient and ultimately the agency from a cash flow perspective. So another key feature within this dashboard is going to be that LUPA risk alert, which is going to indicate if the patient has been seen enough times to avoid being below that LUPA threshold for that billing period and really ensure that the agency is getting the full reimbursement for that period. So we know that we really want to avoid a LUPA at all costs, and this information is readily available for you here. You can also see here the HERG score, which is what determines our reimbursement. So you will see that we actually identify for the organization for each billing period. This is also going to take into account factors such as the episode timing. Is it an early timing or a late timing? The primary diagnosis and what is the clinical grouping associated with those diagnoses, which we know is incredibly important because that reimbursement is now based on those clinical groupings themselves. Another key feature that we want to highlight is the ability to navigate to the patient's plan of care summary and the plan of care itself, so that the user viewing this can quickly maneuver and navigate so they can see easily, are we meeting the goals that we have identified for this patient? How are things looking from a plan of care perspective? Are we really staying true to what we have identified are the patient's needs? You can easily see documents to see if this patient has a face-to-face on file in case of an ADR or something like that. We've also included the supplies listed there for you, as well as the frequency and duration for the episode itself. So as you're getting those frequency and duration orders, you're going to be able to track and see all of that information here in one place. Ultimately, we really wanted to provide all this information in one central location for the patient itself, so that as an agency, you can make informed and educated decisions for each of your patients. For instance, you could say, okay, so we have 10 more visits for this patient, but our cost analysis in the dashboard is showing us that we've already spent more than we've anticipated. So you might need to reconsider getting the patient's caregiver involved to help support the patient, so that you're not running the risk of essentially running out of funds when it comes to this patient and the reimbursement that you're expecting. You can also infer from that scenario that I just gave you that you may need to try to minimize the amount of time that the clinician is in the home, or maybe speak with the physician to say, hey, this patient is really improving. We need to consider possibly decreasing the number of visits. And therefore, you can really empower the patient and their associated caregivers to really step in and support the individual. So you can see this feature itself, this dashboard, is highly, highly important for our agencies. We really want to give you the full picture, the full scope of what you're getting into with this patient, and really what the expectation is. So from a cash flow and a reimbursement perspective, you know exactly what it is that you're looking at here. Next, we're going to take a look at our PDGM modeling tool. This is found within the PDGM tab that we have there, and it's going to be the third option down, that PDGM modeling tool. This is another great resource in addition to that dashboard. So that dashboard is going to be contingent on the patient already being existing within Axxess. However, this modeling tool gives you the opportunity to really come in and put in a referral or a prospective patient's information to see if that is going to be the best fit for your agency from a reimbursement perspective. So first, we're going to touch on our admission source and timing. A lot of times agencies will know where the referral is coming from, and they will typically know whether or not this referral has had recent home health care. Are they coming from a hospital? And we know those are some of the things that are really going to determine if that's an early or a late timing episode. And you can see here we've got those 4 different categories listed for you. So we've got the community early, community late, institutional early, and institutional late. So each of those categories is equally important because they do hold a different reimbursement rate, and that is going to help you understand what that reimbursement rate is going to be as we continue to enter information into this tool. Then we have the opportunity for agencies to list their diagnosis codes and really gain some insight into what those clinical groupings that we just talked about are going to enter for a reimbursement period for you. So as you enter those ICD-10 codes, which you can do, you can either enter in the alphanumeric code itself, if you know what that is for that specific diagnosis, or you can use the keyword search bar to locate the code. As you're typing things into the keyword, it is going to continue to drill down to other diagnoses that fall within those categories, so that it's really taking the guesswork out of that for you. We've got all of that information right here in the tool for you. As you're selecting those codes, you'll notice that the clinical grouping is automatically updating based off of that diagnosis information. This is so, so important because as you are continuing to obtain information about this referral, you can come back and update the information in the modeling tool so that your team really has a full understanding of the scope of care that you would be providing should you choose to admit this patient within your organization. We also automatically identify for you whether the comorbidity adjustment would be low or high, or if there is none altogether. And without this tool, it really is a total guessing game for agencies to try to predict potential reimbursement, profit margins, and things of that sort. So we are really taking the guesswork out of this for our clients so that you can feel confident in the decisions that you're making about some of these referrals that you may be taking on. And additionally, you can see at the bottom, the information that we are entering is generating information into these first and second 30-day billing periods. This is going to include your case mix information, your HIPS code, the LUPA threshold, and finally that potential reimbursement, which we know is so highly important. So you can see this tool is really extremely beneficial for agencies to help them thrive under PDGM and importantly, these new CMS regulations that are coming down for 2021. And the last thing that I would like to touch on today is going to be our enhanced financial reporting. So if we go to the reports tab and the reports center, the main report that I do want to showcase for you here is the month-end AR report. Our financial team has really been very hard at work reviewing all of our reporting to ensure that all of the necessary information that you need is not only here within the Axxess Home Health platform, but that it's easily accessible and you're able to efficiently manage your financials right from the Axxess Home Health platform. So the primary report that we're going to look at again is that month-end AR report, and the user will get a notification once we have actually requested the report, but first we're going to touch on what those actual parameters look like. So within the report itself, you can filter for any branch that you have associated with your agency and have access to. You can drill this down by payer. So if you know there's a couple of payers that you would like to look at, maybe you only want to look at your Medicare payers, or maybe you want to look at all of them together, you can make those selections right here within the parameters. Next, we have our payer class. So are you looking to run this report for episodic versus per visit payers? We have our through closing date, which you can select, you can key that in there. And then we also have our aged AR type. So are you looking to run this based off of the bill date, the claim start date, or the claim end date? So you've got quite a few options here when running this report. And again, once you select your parameters, you do have to select that request report. Because of the amount of data that this report is potentially pulling, it does go into a separate section of our report center. So if we go up to the reports tab and then select the completed reports, we'll see all of the reports that I have previously ran here. And the importance of this completed report center really is to ensure that as I'm pulling these large amounts of data, I'm not having to sit on the report center screen and wait on that report to run. Instead, I can let that report continue running and pulling up in the background, and that is going to allow me to continue working and doing other things that I need to do within the Axxess Home Health platform itself, whether it be reviewing other financial data, managing my patient records, looking at my billing center to see what's going on there. But that's going to be just highly, highly important to be able to go and pull that information from the completed reports tab when it's available. Some important pieces of information that are going to be found on that report. You're going to be able to see the claim bill date, the amount of the claim, whether or not we've received the claim, was that claim paid in full, or were there any adjustments to be expected? So you're really going to get a full picture when you run that report. You're going to be able to download and see all of that information. That's really going to be essential to ensuring that your organization is thriving under PDGM and really that no pay wrap regulation that's coming up in 2021.
And so with all of these solution updates, as Brandi was saying, a lot of these were created in 2019 to be utilized for 2020. And so as Brandi stated before, we have made sure that we are always forward thinking and innovative with the different solutions and features that we are adding into Axxess Home Health. And so the next thing that we really want to look at is the billing workflow for 2021. And I want to show you what that looks like from when we are admitting a patient. What I've done, just to save us a little bit of time on our webinar today, so you don't worry about hearing my voice too much longer, is I have started already adding patient information. And so I'm going to go ahead and look at my pending admissions. This is where the patient is at. And I'm going to go ahead and start editing this information once more. So once we've gone through and we've started to put our information for our patient, and we've gone through all of our toggles, you'll see here we've added all of our required fields. We'll just go ahead and go through. I want to make sure that our payer is identified as well. And then we can go ahead and let's click on admit and see if we've got anything pending. And as we're clicking on admit, this is really going to give our system notice that the patient has been admitted, and ultimately now we'll be able to see this patient within the billing center. So that's where we're going to go to next. So once we click here on our billing tab up top, or we hover over, we can go ahead and click on our billing center, and we'll look specifically for this patient since we've got a lot of information here. And you'll see there that the patient we just added, Rain McCoy, is now showing up for us. And you'll see in our billing center, as we've gotten here, that we've got some changes going on as well in here. And notably, as we were talking about a little bit ago, those yellow indicators for our OASIS and our billable visits. And so this particular workflow, again, is going to be ensuring that we are maximizing our efficiency as billers and within our companies as well, our organizations, but also that we're not skipping steps and there isn't an opportunity for us to have a wrap fall through the cracks. You'll see also that we have our wrap aging tool available for us, and something that I really want to point out as we're looking at this wrap aging tool is our negative age here. So our negative aged claims are going to be those second billing period claims. And so we'll see that we do have them in our green legend, indicating that these claims can be filed at this time and should be submitted and accepted in a timely manner. And so we can send those out as quickly as possible for these claims. The other thing that I want to show you, if you hadn't already noticed, and we'll go ahead and refine our search bar here just to make this a little bit easier on the eyes, is that both of those billing claims are now available for us within our testing solution, which is what I'm showing to you here. You'll see that we've got some current dates showing, some dates within 2020 within our testing solution to ensure that we are providing the best product and solution for our clients. We did alter the dates of the 2021 regulations so that our simulator would be able to show these updates within real time and not have to wait until January to get this information out to our clients. And so that's why you'll see some dates that are current. You'll see we've got a November and December billing period here as we go forward. Now, one thing I do want to do is I want to go through one specific claim here. So we'll look at the first claim for this episode, and you'll see here that we do have these claims that are able to open. So our hyperlink is active, even though we do not have this information just yet within our system. We can already start to verify that claim. So we can come through our wrap claim and verify all of the information as far as demographics are concerned. You'll see that our primary diagnosis is within our claim as well as the first billable visit date. Now, this date is populating the date of the from date for the billing period. So because our billing period start date is 11/9, you'll see that our first billable date is 11/9 as well. So we can go ahead and verify this claim through. And I'm going to go ahead and process this claim as we are submitting. So let's go ahead and click on our checkbox here and generate the selected claim. We will mark this claim as submitted. And if you do also have our DDE service, you'll know that that would be a button that just says submit claim. So once we do that, I really want to show what the UBO4 is going to look like. So we're going to go next into our claims history that's embedded here within our billing center, something that we've made convenient for our clients. And let's look up this patient. So as we're looking up patient Rain McCoy, you'll see that we have their billing periods accessible under their episode, and that we have already submitted that wrap claim. And we do have identified a bill date for us. We'll open up this UBO4 claim specifically so that we can see the new changes to our billing claim, or our wrap claim rather. So in here, you'll notice that we do have all of our demographics available. Some of the major features to note their absence are going to be our value code 61 and 85 that normally sit here in this portion of our UBO4 under locator 39. So you'll notice value code 61, which is our CBSA code, and value code 85, which is our FIPS code, are no longer on the wrap. They are no longer required to be submitted on the wrap. However, they do still need to be on the final claim, and Axxess is ensuring that all of the information that is required on both the wrap and the final are still embedded on both claims. So again, to maximize efficiency and ensuring that our clients are getting paid as fast as possible. You will see here that we do have a HCPCS code that has been generated for us, although we have not completed the OASIS assessment, which generally creates this grouper code for us. This HIPS code will be the generic HIPS code that we use across the board for all of the wraps and final claims, provided that that information is incomplete. Now, if you have a superstar clinician that has completed their start of care information and their OASIS assessment within the timeliness to get that wrap submitted to CMS, then the claim, the HCPCS rather, that is created within that OASIS assessment will be utilized here instead. But that will only be on the occasions when that information has been completed through. Otherwise, it will be this generic HIPS code that we utilize here. You'll also notice down here at the bottom of our claim that the only diagnosis code indicated is our primary diagnosis. We no longer are required to include any additional diagnoses on the wrap claim. And a particular thing to note as well is that the diagnosis code does not need to match from the wrap submission to the final submission. So that's another key feature or factor in these loosened requirements that some agencies are really focusing on, because we may know some of the scope of the care that we should be providing for a client or for a patient when we are in their home. But it doesn't always end up that way. We end up finding sometimes a wound or identify that the patient might need physical therapy, and now that is the primary reason why we are in the home. So this gives us that opportunity for the diagnosis codes to no longer be matching. It gives us the opportunity to ensure, again, that we're being fast on that wrap submission, but more importantly, that our documentation ultimately is true and is ensuring that we are maximizing our reimbursement as well, based on the care that the patient is receiving. And now I want to show you, as I push into full screen again, I want to show you what now the split percentage claim will look like. We do already have another patient here in our system that has already submitted their first wrap under the new 2021 regulations. So I do want to show you what that final claim versus wrap claim split looks like within that particular, or within this particular patient's chart. So we'll see here this episode for patient West McCoy as we've come down to file in our in our billing history here. We'll look at the billing period for November to December. You'll see that the wrap has been submitted and that the claim amount showing on the wrap is $0. Next, you'll see that our final has been created. I have started the process of verifying this final for us. And you'll see that as I verified the final for us, that the claim amount is showing the full amount. Now, to verify that, I want to make sure that we know another place where we can see this potential reimbursement. And so to verify, we'll go to the patient's chart. And we will look at our analysis of our cost here under our Oasis D start of care. And again, this is one of those prior solution highlights that has been embedded into our solution for years now, really. That is a great tool for us to have that high level view of what our reimbursements look like. And you'll see here that for that first 30-day billing period, our reimbursement should be a little over $2,300. And that is in fact what is displaying over here within our billing center and our claims history. Now, lastly, I want to touch on as well setting up the payer information for our HMOs and specifically highlighting how to edit that information, because I know for a lot of our payers, they're payers that we are still servicing clients with, right? Maybe it's Blue Cross Blue Shield, or maybe it's Molina or Aetna or Humana, all of these different payers that we are actively seeing clients for, and we simply need to modify how they will be adopting these new changes. And so we'll navigate back into our payer list that Brandi was recently in, and so we'll go to View, Lists, and Insurances. I'll go ahead and maximize this for us to see. And we can go ahead and start looking at our insurances. And so I did already start reviewing an insurance for us. And so what you'll first want to do is identify the insurance you're going to modify. So we'll go ahead and start identifying this insurance. And as you identify it, you'll see to the right of your page here that we do have the edit action item. And so we can go ahead and click on that. It's going to open up the setup for that particular managed payer. And then in here, we can go ahead and continue to customize. We'll scroll down a little bit into the page, and you'll see here that within our episodic payer class, we have another edit action item. We'll click on that as well, and this new pop-up window will show for us, indicating some of the customization features that we can include for this HMO payer. You'll see as we go down the list that I have checked off some of our features for us. These are the features that we wanted to highlight because these are specifically for our 2021 regulatory changes. So first off, the one thing that we do want to say primarily is that because the 2021 no pay wrap and wrap requirements are part of the transition with PDGM, in order for these two boxes to be active or able to be enabled within the system, you do have to also ensure that you have checked off the opportunity to have this particular payer follow PDGM billing requirements. So if this particular toggle is not in effect, you'll notice I've unchecked it. If we go ahead and try to save, we'll get a warning within our solution telling us that we are not able to toggle on our no pay wrap toggles unless we have that PDGM toggle enabled. So we'll go ahead and click that back on. And now we'll look at these two episodic payer toggles. This first one here that is asking us to check this box to enable no pay wraps is a very basic foundation of this regulatory change, which is that we no longer have an 80-20 split for our wrap reimbursement and our PPS system, right? So this particular change is only to identify that our wraps will be paid at 0%. Now, if our HMO or managed care payer decides that they are going to incorporate or adopt all of these 2021 regulatory changes as CMS has laid them out, then they can go ahead and also enable this toggle. And this toggle is a little bit more specific. This toggle does allow for the removal of the requirement of the OASIS assessment, as well as the removal of the requirement of the first billable visit. And so that's going to be information that is really beneficial as we are having those conversations with each HMO as organizations or ourselves here at Axxess. When we find out more information from more payers, we will do our best to ensure that these are actively available for customization, but they are available to our clients and they are available now to our clients if those conversations have already been had or that communication has already been delivered to organizations regarding HMO's adoption of the 2021 rules. And so you'll see that as you save and close, you will get your notification that those line items have been updated successfully. Now let's go ahead and go back into our presentation so that we can discuss some of those educational resources.
Okay, thank you, Sophie. The first thing that we are going to talk about with our resources is going to be our educational resources. So we've got some of those listed out here for you. So we have our Help Center FAQ page. This FAQ page is really a billing FAQ page. And the purpose of that is to compile all of the questions, both regulatory related and product related, into one central location within our Help Center, so that you're able to go and click through and find the information that you're needing all within one place. We are continuing to update that on a weekly basis. So as new questions and new information is coming out, as we're getting more questions internally and externally, we're compiling those and continuing to update that with new information every single week. So you're really going to be getting really up-to-date information on that page. Next, we have our user community. This is a very interactive user community for Axxess that is out there on axxess.com. This is where clients can interact directly with each other or with our industry experts right here at Axxess. You can ask questions, and not just pertaining to RAP 2021 billing changes, but you can really ask questions about anything and everything related to the home health industry, and you can talk amongst yourselves and with the Axxess team to get the answers that you're needing. We have our on-demand video page, which I'm going to be talking about in just a little bit more detail on a future slide. We are going to be talking about the PDGM resource page, the blogs that we have out there, as well as our software dashboard. So for our Help Center FAQ page and user community that I mentioned first, you can see here on the left-hand side of your screen, this is a screenshot of what that billing 2021 FAQ page looks like. It is found within the Help Center under Home Health. And then if you click on that billing financial tab, it's going to be the very last option there listed, that billing 2021 FAQ. You can see here all the questions are listed out for you, and if you hit that plus sign to the left of each question, it is going to drop down the answer to that question. On the right side of the page, these are some screenshots from our user community so that you can see this is very interactive. We have our Axxess team on the user community all day, every day, really making sure that we are supporting and answering the questions that are coming through in a timely manner, so you can really get very, very quick answers to all your questions from the Axxess team. We have our on-demand video page. So within that video page, we do have a library of videos for you, but we specifically want to highlight those related to revenue cycle management, or RCM. So here you're going to find a great deal of informational videos about the upcoming changes and how to navigate these new requirements so that your organization can really thrive and continue to grow under these new rules coming in 2021. Our PDGM resource page was actually established back in 2019, prior to the onset of the PDGM regulations that took effect in 2020. And this is really your one-stop shop for PDGM related information. This is not only going to include detailed regulatory information, but we've also provided different worksheets, tools, all sorts of articles, anything that we can find around PDGM or create for you, we have listed it here to really ensure your success under PDGM. Then we have our blogs. So our blog page hosts a library of blog compositions from industry experts right here at Axxess. We have recently added several new blogs specifically around the no pay wrap regulations, as well as other changes coming for 2021. So be sure to go check that out. You can see we've got a couple listed here for you. Shake up your staffing operations for 2021. So that's going to be all the ins and outs of staffing that you need to know. We've got your billing changes to expect in the coming years. So that's really going to take us looking beyond 2021. As we know that NOA is coming, that's going to talk about some of the other changes that we're expecting to come down from CMS so that you can start preparing yourself and your organization to make sure that you're going to be successful in the coming years. And the final one we want to highlight here today is the benefits of the home health no pay wrap. There are some benefits hidden in there within those regulations, and we really want to make sure that we're showcasing those so that you can really take full advantage of those regulations. And finally, we have our software dashboard. This dashboard is available. You saw that on the demonstration. Once you have logged into Axxess Home Health, the dashboard will be populated in these boxes that you see here with up-to-date information about the upcoming regulatory changes, blogs that we have recently released. You're going to be able to see news and updates from other sources as well as within Axxess. And we've also got our video there. So that video is going to be some updated information that we have for you, whether it be a recorded webinar, such as this one right now, or some other videos and other things that we think are really gonna help bolster that knowledge that you're needing going into the 2021 regulatory changes. And we wanna make sure that you and your organization are really fully prepared by putting this right at the forefront. So right as you log in and access the Axxess Home Health tab within the Axxess Planner, you're going to see this information. So anything that you're needing to see, anything that you're needing to know, we're going to put right here in front of you to call attention to that.
And with that, we really wanted to conclude today's webinar going through our solution highlights and a product demonstration of our solution and what we've prepared for 2021. We hope that this webinar has been informational as well as exciting as we show these new features and prepare for what's to come. Please know that we will continue to provide additional education as we receive it from CMS, and that we do intend to continue these webinars going into 2022 and what we expect for the notice of admission and those changes as they come out. Thank you once again for joining us, and if you have any questions, please reach out to our team or utilize all of those educational resources that Brandi talked on to get your answers as quickly as possible. Remember, Axxess is available anytime, anywhere, and we're here to fulfill your needs.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.